Welcome to Advanced Care Planning. What is it and why now? Thank you for attending this session. This is part one of a three-part series that was developed from a presentation that was originally created by Carly Olson, DNP, with attribution to Nancy Joyner, a palliative care clinical nurse specialist, and has been adapted to a Synthesia AI presentation. Advanced Care Planning North Dakota, or ACPND, will be referenced throughout this presentation. This organization, formerly known as Honoring Choices North Dakota, was developed in June of 2013 and was established as a statewide initiative to improve advanced care planning across the state. The governing board is comprised of a multidisciplinary group of individuals from various professions and organizations across the state of North Dakota. The overarching goal of ACPND is to educate community members on developing a successful advanced care planning process. The objectives for this three-part series on advanced care planning are to introduce advanced care planning with terms and definitions, reflect on what matters in regard to medical decisions, and provide instructions on how to complete and share your plan. Welcome to Part 1, an introduction. This presentation is designed to help you better understand the advanced care planning process. We'll also explore important legal documents such as healthcare directives and living trusts, and clarify key medical terms associated with advanced care planning. To start off, what is advanced care planning? Advanced care planning is a process that supports adults at any age or stage of health in understanding and sharing their personal values, life goals, and preferences regarding future medical care. The goal of advanced care planning is to help ensure that people receive medical care that is consistent with their values, goals, and preferences during serious and chronic illness. This really is a process. We can begin this planning today, but what if your values or preferences change in the future? Well, that's perfectly okay. It can be revisited and updated when anything changes. It is helpful to be familiar with the legal documents that may be part of an advanced care plan. So, let's compare them. The terms Healthcare Directive and Advance Directive, Durable Power of Attorney, and Living Will are often used interchangeably. However, the terms Living Will and Living Trust are not. A living trust focuses on your finances and assets. This presentation, however, focuses on healthcare directives or advance directives, which outline your medical preferences in the event you are unable to make your own healthcare decisions. An advance directive is a broad term for various documents outlining your healthcare wishes if you become unable to communicate them. It typically includes a living will and a healthcare power of attorney. A living will is a type of advance directive. It specifies your wishes regarding medical treatments you want or don't want if you're terminally ill or permanently unconscious. It primarily focuses on end-of-life care decisions. Durable Power of Attorney for Healthcare is a document that appoints someone called an agent to make healthcare decisions on your behalf if you're unable to do so. Unlike a living will, it covers a broader range of healthcare decisions, not just those related to end-of-life care. Healthcare Directive encompasses both a living will and a durable power of attorney for healthcare. Next, let's explore more terminology and definitions. When specifying medical treatment preferences in an advance directive, consider addressing the following areas to clearly communicate your choices. Do you want life-sustaining treatments? Cardiopulmonary resuscitation, CPR. Indicate whether you want attempts to restart your heart if it stops beating. Mechanical ventilation. Decide if you want to be placed on a ventilator to assist with breathing and for how long. Artificial nutrition and hydration. Specify if you want feeding tubes or IV fluids if you are unable to eat or drink. Pain management. State your preferences for pain relief, including the use of strong medications like opioids, even if they may hasten death as a side effect. Do you want treatments such as antibiotics, dialysis, or chemotherapy? Indicate if you want hospice or palliative care to focus on comfort rather than treatment of the condition. A full code means that your healthcare team will do everything that they can to resuscitate you. This may include CPR or shocking your heart, placing a breathing tube, and administering numerous medications. A Do Not Resuscitate Order, or DNR, is a code status that informs your healthcare team that you do not want to receive CPR in the event that your heart stops. Your healthcare team will not perform chest compressions, administer resuscitative drugs, or shock your heart to gain a normal rhythm back. A Do Not Intubate Order, or DNI, is a code status that informs your healthcare team that you do not want to be intubated or have a breathing tube placed. One thing to point out is, in the event of a surgery, particularly an elective surgery, some patients who are a DNR and DNI may be given the option to reverse their code status. This will most likely be at the discretion of your surgeon and the surgery that you are undergoing. Invasive surgeries, such as a hip replacement, require general anesthesia, by which you must have a breathing tube in place to receive the anesthesia medications and be put to sleep. So for the surgery, your healthcare team can reverse your code status, make you a full code, perform the procedure, and then switch it back to DNR/DNI before you are discharged from the hospital. Allowing natural death, also referred to as comfort care, denotes that the patient wants to die a natural death, not hooked up to machines, and be kept comfortable in their final moments of life. Of note, allowing natural death or electing only comfort care measures is not viewed as giving up hope on life. The choice may be allowing someone to die a more peaceful death, or spend the final moments without forceful or aggressive medical care. Moreover, this may allow the individual to die surrounded by family and friends, with the ability to communicate. These terms might feel overwhelming, but that's exactly why we created these advanced care planning videos. Familiarizing yourself with some of these terms before a healthcare crisis can be helpful. You don't need to memorize everything, but the goal is to increase your understanding so you feel more confident when completing an advance directive or facing a medical emergency. Thank you for joining us for Part 1 of Advanced Care Planning. In this session, we have talked about advanced care planning, why it is important, and explained terms you might hear. Further information on advanced care planning can be found in the next 2 parts of this series. Part 2 will give you an overview of what matters and how to have a conversation with your loved ones, and Part 3 covers how to complete and share your plan.